Dologen is a combination product containing acetaminophen and an antihistamine. Acetaminophen helps reduce fever and mild to moderate pain, such as headache, backache, and muscle strain. The antihistamine in this product may cause drowsiness, so it can be used as a nighttime sleep aid. It also helps relieve allergy or cold symptoms like watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. Additionally, long-acting tablets/capsules are not recommended for use in children younger than 12 years. It's important to follow all dosage directions carefully to decrease the risk of serious side effects. Do not use this product to make a child sleepy, and avoid giving other cough and cold medications that may contain similar ingredients without consulting a doctor or pharmacist. Always talk to your doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Dologen, make sure to carefully follow the instructions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. You can take Dologen by mouth with or without food, but if you experience stomach upset, taking it with food or milk may help. If you're using the liquid form, be sure to measure your prescribed dose using a medication measuring device or spoon, not a household spoon. For extended-release capsules, swallow them whole and do not crush or chew them. The dosage will be based on your medical condition and how you respond to the treatment. Pain medications work best when used at the first signs of pain. Do not take Dologen for pain for more than 10 days, adults, or 5 days, children, unless directed by a doctor, and for fever for more than 3 days unless directed by your doctor. If your condition worsens or if you think you may have a serious medical problem, seek medical help right away. Some common side effects of taking Dologen include dizziness, drowsiness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects, such as mental or mood changes, like confusion, or difficulty urinating. While a severe allergic reaction to Dologen is rare, it's crucial to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not mentioned, it's best to contact your doctor or pharmacist. And as always, if you have any concerns or questions about the side effects of Dologen, don't hesitate to consult your healthcare provider for more information. Acetaminophen is one of the main ingredients in Dologen. It's important to be careful with how much you take, as taking too much can cause serious liver problems. For adults, the maximum daily dosage of acetaminophen is 4,000 mg, 4 grams. If you have liver issues or if you're giving it to children, you should take less, so it's best to talk to your doctor or pharmacist to figure out the right amount for you. It's also important to make sure you're not taking any other medications that contain acetaminophen without checking with your doctor or pharmacist first. Acetaminophen can be found in many over-the-counter and prescription drugs, such as pain relievers, fever reducers, or cold and flu medications. Always read the labels on your medicines and ask your pharmacist if you're not sure. If you accidentally take too much acetaminophen, you should seek medical help right away, even if you don't feel sick. Symptoms of an overdose can include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the skin or eyes, and dark urine. If you're a regular drinker, it's important to be cautious about combining acetaminophen with alcohol, as it can cause damage to your liver. It's best to avoid alcohol altogether if you're taking Dologen. Before taking Dologen, it's important to talk to your doctor or pharmacist if you are allergic to acetaminophen or antihistamines, or if you have any other allergies. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to discuss your medical history, especially if you have breathing problems, glaucoma, heart disease, high blood pressure, liver disease, stomach/intestinal problems, overactive thyroid gland, or urination problems. Dologen may cause dizziness, drowsiness, or blurred vision, and alcohol or marijuana can intensify these effects. It's recommended to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. It's also important to avoid alcoholic beverages and to talk to your doctor if you are using marijuana. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid alcohol, sugar, or aspartame, you should use caution when taking liquid Dologen products. It's best to ask your doctor or pharmacist about using this product safely. Before having surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of antihistamines, and in young children, Dologen may cause agitation and excitement instead of drowsiness. Older adults may also be more sensitive to the side effects of Dologen, especially dizziness, drowsiness, confusion, constipation, or trouble urinating, which can increase the risk of falling. During pregnancy, Dologen should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. The drug may also pass into breast milk and have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Dologen, as they can change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Dologen include antihistamines applied to the skin, ketoconazole, and levoketoconazole. It's also important to let your doctor or pharmacist know if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Antihistamines are ingredients found in many non-prescription products and in some combination prescription medications, so make sure to check the labels on all your medicines, such as allergy or cough and cold products. This is because they may also contain an antihistamine or other ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using those products safely. Lastly, it's important to note that Dologen may interfere with certain medical/lab tests, possibly causing false test results. So, make sure that lab personnel and all your doctors know that you are using this drug. If someone has taken too much Dologen and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call 911 for emergency assistance. Otherwise, contacting a poison control center right away is crucial. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of Dologen overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes or skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Remember to keep Dologen out of reach of children and to always take the medication as directed by a healthcare professional. If Dologen has been prescribed to you by a doctor, it is important that you do not share it with anyone else. It is important to keep all of your medical and lab appointments while taking Dologen. This will help to ensure that the medication is working correctly for you. If you are taking Dologen on a regular schedule and forget to take a dose, take it as soon as you remember. If it is close to the time of your next dose, then skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing Dologen, it's important to keep it at room temperature, away from light and moisture. Be sure not to store it in the bathroom and avoid freezing the liquid forms of this product. Keep all medications out of reach of children and pets. When it comes to getting rid of Dologen, make sure not to flush it down the toilet or pour it into a drain unless directed to do so. Properly dispose of this product and it is expired or no longer needed. If you're unsure of how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.